human metapneumovirus, HMPV, which has, I love this picture. This picture is posted on our group by Dr. Paras. So I took this old wine or virus in new avatar, or basically it is a news star. So in मतलब news ने इसको provocate किया है, तो I like it. It is very pertinent to this topic. कि HMPV, definitely it is a very old virus. So human metapneumovirus, what is it? It is a respiratory virus. It discovered in 2001 in Netherlands by Dutch scientists. Belongs to the pneumoviridae family. Two genetic lineages, A1, A2, B1 and B2. It causes upper and lower respiratory tract infection, mostly in children in winters. So higher risk to the young children, older adult and people with a weak immunity. So old virus, what are the early evidence? Even before the 2001, we have there is a history that this virus was existing even lay back to 1950s and 1960s. How we do know? Serological studies. Few serological studies has been done. Blood samples from the 1950 and 1960. They found this is the HMPV antibodies. Archived respiratory samples. Few analysis. I mean, this is all done in the research labs. So historical reports, review of the old medical literature, uncovered description of the respiratory illness with symptom consistent with the HMPV infection. So what does it mean? That this virus is existing since long. With always in winters, maybe many people are getting this and unknowingly, I mean not knowingly or unknowingly, it is coming and going away. So why it went in undetected? Problem was कि limited diagnostic tool. अभी तक हमारे पास इन सब चीजों को अभी हमारे पास बहुत अच्छे रेस्पिरेटरी पैनल आ गए हैं, पहले इतने डायग्नोस्टिक टूल नहीं थे. So before 2001, diagnostic methods were not advanced enough to detect HMPV. Misclassification, there was misclassification because it was a respiratory virus, so respiratory RSV के अंडर आता था, respiratory syncytial virus. Lack of awareness, the medical community was not aware of HMPV existence, leading to under-reporting or under-diagnosing. So why the concern? Concern is basically because it gets the limelight due to the China. Chinese Center of Disease Control and Prevention has reported a sharp increase in HMPV cases since December 2024 in northern provinces. So that was because वो कहते हैं ना कोई एक टॉपिक लिमिट वो चाहिए, तो चाइना की तरफ से अगर कुछ आता है तो वो दैट इज अगेन कॉज ऑफ कंसर्न फॉर द मीडिया. एक लाइमलाइट में आ गया है वायरस, दैट इज द ओनली थिंग. Respiratory infection on the rise. China is experiencing an increase in respiratory infection, including HMPV, particularly in the northern provinces of the China. Seasonal pattern. It has a seasonal pattern. The current situation reflects a seasonal rise in respiratory infection caused by the common respiratory pathogens. What WHO monitoring this? WHO is monitoring the situation and has not received any report of unusual outbreak patterns. So healthcare system, the Chinese healthcare system is not overwhelmed and hospital utilization is currently lower than this time last year. So it is maybe the media is more provoking this virus than actually it is concerned. Is COVID back? No, they are two different viruses. HMPV, you can see this, and COVID-19. Definitely the all virus has the same type of the structure with the different differences in their quality and different in many, even the structure is different, but they looks like same. So what are the differences? Different group of virus, seasonal transmission pattern. HMPV is not new. Severity of symptoms, transmissibility, and target population. Like I have just mentioned, what is the HMPV versus COVID-19? HMPV belongs to the Paramyxoviridae family, a group of viruses that also includes the respiratory syncytial virus, RSV. COVID-19 was SARS-CoV-2 virus का part था, which is a part of the Coronaviridae family. HMPV primarily circulates in the older months. कोविड हम लोग अब जो देख रहे हैं वो कोविड इज ए ईयर राउंड ट्रांसमिशन. सो HMPV is not a new virus. COVID-19 first detected in 2019. HMPV is less transmissible. COVID-19 is more transmissible than HMPV. There is no vaccine for HMPV. and COVID has a vaccine. So these are the few mota differences of these virus, this two virus. Symptoms, I can say the same of HMPV, COVID-19 or all the viral illnesses. Most common symptoms: cough, fever, nasal congestion, shortness of breath, severe cases, bronchitis, pneumonia. So which is we are facing, I mean, even every day in ourselves, in our family, in OPD, everywhere these cough, cold, nasal congestion and these are the common problem, which we are saying, whether it is a flu, it can be H1N1, it can be H1N2, it can be common cold. So there are so many names of these symptoms. So vulnerable population: infants, children less than 5 years, older, more than 65 years, immunocompromised, and the patients with the chronic illnesses and many comorbidities, multiple disease patterns. Red flags: when we need to think we are just in a trouble. High fever persists more than 102 degree Fahrenheit or 39 degree Celsius for more than 5 days. Breathing difficulties, wheezing or rapid breathing. Dehydration signs: dry mouth, no tears, reduced urination, especially in the children. Severe fatigue or confusion in adults. Symptoms worsen after initial improvement. So then we need to definitely think about the diagnosis of the HMPV. Transmission: same way of transmission as the COVID-19 or any other viral illness. HMPV is spread from person to person through droplets from coughing or sneezing, close personal contact such as the touching or shaking hand, touching contaminated surfaces, and then touching the mouth, nose or ears or eyes. Incubation period 3 to 6 days, which is estimated, but infected period is 2 to 7 days only. So after even 7 days, person is not may not transmit to the others. Seasonality: usually it begins in winter and lasts through spring. CDC surveillance data shows that HMPV is most active during late winter and the spring season. So prevention is similar to the COVID-19. What are all the respiratory? Washing hand, wash hand. So 20 seconds washing hand is the key to prevent many infections, not only this HMPV or COVID, many respiratory infections. Avoiding touching eyes, nose, mouth with unwashed hand, avoiding close contact with the people who are sick, covering the mouth and nose when coughing or sneezing. Cough etiquettes, definitely. I mean, COVID had taught everything. Cleaning frequently touched surface, staying at home when sick. So not to spread. Avoid being in a crowded place. Avoid being in a close, small area with so many people. So एरी जो जितना भी एरिया है उसमें ट्रांसमिशन कम होगा, क्लोज रूम्स में ट्रांसमिशन डेफिनेटली ज्यादा होगा. So especially the precautions for lactating mothers, since it is a gynae group, so mainly, and it is more harming to the infants. So maintaining the good hygiene, wash hand before the breastfeeding, that is the most important thing which you should tell all your breastfeeding patients. So avoid coughing or sneezing near the infant. Definitely it is not transmitting through the mother's milk. But if the mother is having such symptoms and while taking care of the child or while breastfeeding, she can transmit the infection. So that's why these precautions are must. Wear a mask if symptomatic. And does it pass from the mother to child? It is not transmitting definitely, but via respiratory droplets only. So breastfeeding can provide some immunity through the maternal antibodies. So we should not कि माँ को हो गया है तो बच्चे को दूर रखना है. So that is not in that case. Only thing, the contact prevention and hygiene should be maintained. Diagnosis. Now, basically, there are diagnoses available. That's why we are diagnosing it much. Nucleic acid amplification test, NAT, like RT-PCR, antigen detection tests are available, but these are not very reliable, and we are not doing. Serology test may be utilizing during outbreaks, but require validation with the RT-PCR. So, abhi, as of now, there is available only the RT-PCR. And especially while the patients are admitting, what tests we are doing, especially in the admitting patients who are on ventilator, patients who are admitted with the pneumonia, where we are doing the biofires. So I have just put the few tests which are available These are the codes from the Max lab. So I'm not promoting here the any lab, just for the sake of the you people, ki what are the tests available. It must be the with the all the lab, Lals and everyone must be having these tests. So human metapneumovirus, RT-PCR. This is the sample type, nasopharyngeal swab, sputum, BAL, ET aspirate और वेंटिलेटिंग ट्यूब. इन सब से कहीं से भी हम सिक्रेशंस लेकर टेस्ट को कर सकते हैं. डेली मतलब दिस इज द रिपोर्टिंग इन वन डे. इट कैन बी costing around 3,000 rupees. Extended flu panel, which is including the HMPV, multiplex RT-PCR. Multiplex RT-PCR, when somebody is having these kind of the symptoms and we want to know what kind of the virus it is. So there are few pathogen: human metapneumovirus, influenza A, H1N1, H3N2, influenza B, influenza C, enterovirus. It is detecting the all type of these pathogens. So it is costing around the 6,500 rupees. And this is also the nasopharyngeal swab, sputum, bar, ET aspirate or VTM. There is a upper respiratory panel biofire. Basically, जो हम bronchoscopy करते हैं, generally pulmonologists are sending this biofire test. Yeah, sputum, where sometimes we have the multiple problems. The patient is having tuberculosis or we are just unable to diagnose what exactly. So now this test is very popular, especially in the IPD patients. So they are sending this. This is containing the human metapneumovirus, and that's how most of the cases, जितने भी cases अभी तक detect हुए हैं, वो यहीं से आ रहे हैं. किसी ने particularly human metapneumovirus के लिए टेस्ट नहीं भेजा था. टेस्ट भेजा था रेस्पिरेटरी पैनल, जिसमें कि वो metapneumovirus टेस्ट पॉजिटिव आया. तो उसकी वजह से ये इस तरह की जो चीजें हैं वो आने लगी हैं. Although it is coming every year. Last year also, when I mean in Max, we detected this HMPV somewhere. So these are in definitely in our ID group. We are just getting this for since long. Like biofire test, metapneumovirus positive. Rest everything is negative. Metapneumovirus is positive. So these are coming commonly. So this is how they are just tracking. Upper respiratory panel, lower respiratory panel, biofire. This is also. This test, this pathogen is included. That's why we are getting this. So infection control measure in clinical setting. Isolation practices, definitely if someone is sick, especially the children, if they are sick, don't send them to the school. That is the main prevention. कि उनको जो है crowd में या you should teach them कि they should be like little away from the children if there are anyone who is coughing or sneezing. So, and the mask use. Contact and droplet isolation for infants and young children with respiratory infections. And there is no discharge practices if some patient is having the HMPV and he's admitted and we want to discharge. Definitely we are not doing the control test. RT-PCR nasopharyngeal swab is not routinely recommended. After 2 to 7 days, infected phase, once the patient is recovered, patient can be discharged easily. So do we have the vaccine for this? Definitely not. There is no vaccine available yet to protect against the human metapneumovirus, unlike COVID-19, which we had the vaccine, and because that also has been made in an emergency situation. So if some outbreak will come for the metapneumovirus, we believe that this vaccine will be ready within 6 months or 1 year down the lane. But Abhi, what is in the pipeline? Novavax HMPV vaccine in phase 1 clinical trial. This vaccine uses a recombinant protein to induce immunity. Pfizer HMPV vaccine in preclinical development. Sanofi's HMPV vaccine in preclinical development. So there are many things are happening in the research. They are trying to make this vaccine, but definitely the vaccine वो बन के तभी होता है ना, demand versus supply. तो उसी तरह से I believe कि सारी चीजें जो हैं even research lab में भी उसी तरह से उनकी practices चलती है. So challenges in developing the vaccine. Immune response. First thing is HMP infection don't include the long-lasting immunity, making it challenging to develop an effective vaccine. क्योंकि self-limiting है, 2 से 7 दिन में वैसे ही खत्म हो जाता है. Variability. HMPV has 2 main genetic lineages, which may require a vaccine to provide the broad protection. target population, HMPV primarily affects the young children, older adult, and immunocompromised individual, making vaccine development and testing more complex. So these are the few challenges. But in future, researchers are exploring innovative approaches such as the nanoparticle-based vaccine, mRNA-based vaccine, and the combination vaccines. Means like जो flu का vaccine है, that maybe उसी में they will include the respiratory syncytial virus, RSV, influenza, or maybe the HMPV also. While progress is being made, it may take several years for an HMPV vaccine to become available if we don't get this any outbreak. So management definitely, there is no such management, but management part will be taken by Dr. Praveen Gupta. So that's why I skip this. So this is the final slide. What is the symptoms, transmission, and treatment part? So 3 to 6 days. So I have just completed in the, I think, 15 minutes. If I'm ready to for the any kind of the questions.
It was very good, Dr. Ruby. Ma'am, your comments?
Yes, I think, presentation by Dr. Ruby had been absolutely very satisfying and taken away all our worries. And I think, I can only say why the no name had come earlier. The no name had been come earlier was there's so many viruses are going on. And naturally, now because it is becoming a China virus, people are coming to know. Well, and that this is going on for 100 years and one should really not get worried. Every time the people who should get worried about the flu-like fever is the children, especially the newborns, the infants, the old people, the people who are immunocompromised, they have to get worried. Dr. Ruby has specifically not mentioned about pregnancy. I think that is again satisfying to each one of us. I also feel that just like Dr. Ruby, that it is self-limiting and probably it may be incorporated tomorrow is a part of the influenza vaccine. When they pick up the viruses and it is like this, then they will be getting it. But आदमी जब शोर तभी मचता है जब लोग मरते हैं. जब लोग मरते नहीं है तो फिर कोई परेशान होने की जरूरत नहीं है. ठीक है. सो वैसे भी फ्लू के लिए सभी लोग कहते हैं भाई तुम अपने कमरे में रहो, जब आओगे तो सबको इन्फेक्ट करोगे, तो घर में एक जने को फ्लू होगा तो सबको तो फ्लू होगा ही होगा. तो सेम थिंग, सेम प्रिकॉशंस इज. वो हाहाकार कोविड में इसलिए था ना कि पीपल हैड गॉन. पीपल मरेंगे तो परेशानी हो गया, जब तक मरेंगे नहीं तो परेशानी की कोई जरूरत नहीं. एंड नेचुरली फ्रेजाइल आर ओल्ड पीपल एंड people who are very young or people who are immunocompromised. So I think, it is great that, Dr. Ruby presentation has reassured each one of us. But at the same time, घर में clinic में किसी को problem हो तो mask वास्क लगा लेने में थोड़ा सा अच्छा है. हफ्ते 20 दिन mask लगा ले तो ज़्यादा अच्छा रहेगा.
Yes, ma'am. I will especially recommend when you are sitting in the OPD, basically wear the mask. It is even good for all the respiratory infection, not because it is HMPV. Even the COVID-19 is spreading. So you will find the COVID-19 people also around. So there is nothing. Only thing, the worry problem will be there. Ma'am has very clearly meant that log jab marenge. But I believe if this virus is getting the mutation, and mutation kab hota hai? When we are just, provoking this virus, provoking with the over medication, with the antibiotics, and especially the immunocompromised people, when we are not treating them well, only the mutation happens in those, especially in immunocompromised people, when they get this infection and they are not taken care well, तभी इन viruses में mutation होता है. जब हम किसी को मतलब virus को properly treat नहीं करते हैं, handle with care. So especially I believe कि कम से कम इसके लिए कुछ करो, नॉर्मल आए और नॉर्मल शांति से ही चला जाए. So that will be the actually very basic approach.
डॉक्टर रूबी, आपने जैसे कहा कि फ्लैग साइंस क्या, नेचुरली जब हमारे घर में हमें लगता है कि 102 से ऊपर टेम्परेचर नीचे आ ही नहीं रहा है, पेशेंट कंफ्यूज हो रहा है, पेशेंट डिहाइड्रेट हो रहा है, तब आपको अस्पताल लेके जाते हैं. अदरवाइज अस्पताल थोड़ा ना लेकर जाते हैं. सो आई थिंक वेरी राइटली सो. एंड क्योंकि ये न्यूमो वायरस है तो आपके बिसाइड हाई टेम्परेचर, whenever respiratory rate also goes up, and you'll be surprised, respiratory rate goes up earliest, सबसे पहले जाता है. but we gynecologists just do not give attention to it. Please, we should start giving attention to it, that whenever you find the respiratory rate is going up, fever is going up, please take care of themselves, and that is what it is. I think we should really careless भी नहीं होना चाहिए, but at the same time अपना ध्यान रखना चाहिए. सब आप लोग अपने बड़े बड़े लोगों का ध्यान रखें, छोटू का भी ध्यान रखें. That's all I can say.
Thank you, ma'am. Dr. Sangeeta Gupta, ma'am.
Very crisp and very nice presentation, Dr. Ruby, and very apt comments by Madam Jain. In fact, a week before, when I went to one of my family members, then they were talking about HMPV virus, and they were so afraid. At that time, I was not aware to give answer to their queries, but I think after listening to today's talk, now I'll be able to answer any query asked by the persons who are seeing it in the TV and are afraid of the virus. I am now confident enough and knowledgeable enough to answer their questions. And I think we should not be afraid of this virus, but proper hand washing technique and mask, and a bit avoiding to going to the crowded places in this season may help to curb the problem.
Thank you, ma'am. Dr. Pratibha.
Thank you, ma'am. It was very nice presentation, and everything has been covered by the Dr. Ruby. And as we all know that this is not the new virus, and in the MAMC they showed the last 1 year, they showed that in 180 cases which they got the respiratory panel done, there were 5 cases of the HMP virus positive in last 1 year data in children. So it is not new virus, and even during the COVID times, if we take proper precautions, like I always get the seasonal flu, and I very much upset with the seasonal flu, and it takes a time for 1 month or 2 months. But in COVID period, when I was taking all the precautions, I was using mask, I was using sanitizer and properly washing my hands. For the 2 years, I didn't have any cough, any fever,
Yes,
any viral
exactly.
infection.
Exactly.
So taking precautions is very much efficient. Thank you, ma'am.
Thank you, Dr. Pratibha. Dr. Seema Thakur, if you're there, I think she had joined. Dr. Seema Thakur. Oh, she's left. Ma'am, then we move ahead to the second part of the.
Yes, Praveen, we also want, the we yearly flu vaccine we are taking, though it has not been covered, but I think it is advisable कि इस बहाने flu का vaccine otherwise ले लो. अगर 5% में ये नहीं आया तो 95% में और का flu आ जाएगा, तो उसका flu vaccine लेना जरूरी है. I also feel.
Good afternoon, everybody. I would like to just say, ma'am, name origin from China instills fear now. That is the only thing. It instills paranoia amongst everyone. So we just need to take care. It was there, it will be there, and it will just go like a common flu. And no problems at all. Carry on.
Thank you. We move ahead with the practical aspects for HMPV management, and we have Dr. Praveen Gupta, a senior executive member of Delhi Gynae Forum East, alumni of BHU, recipient of APJ Abdul Kalam Appreciation Award. Dr. Praveen, over to you.
Thank you, Dr. Seema. Good afternoon, everyone. Good afternoon, my respected teachers, colleagues, and dear friends. In a second, I'll be sharing my screen.